Welcome to BFK's Breaking News. Recently, there's an epidemic which causes hundreds of thousands of deaths, infections, food shortage, and significant economic impacts by a kind of virus, namely novel COVID-19. Let's discover the origins of this virus. In December 2019, there was a cluster of pneumonia cases in China. Inquiry found that the main reason led to that was by a previous unknown virus, which named the 2019 novel coronavirus. First of all, coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by envelope with spike glycoprotein HE and also which you have different protein M and E. Especially spikes give its appearance of a crown, and a crown in Latin is called corona. That's how these viruses get their names. Besides that, there are different types of coronaviruses. For instance, SARS was first identified in China in 2003. Additionally, MERS also had once appeared in Saudi Arabia in 2012. Finally, to the previous year, the virus had mutated and formed a new strain and has been widespread not only in China but also infected to other countries, which at the present is called nCOVID. These type viruses cause respiratory disease. It can range from common cold to pneumonia, and sometimes cause some illness related to gastrointestinal symptoms. To most of the victims, the symptoms tend to be mild disease. Nevertheless, some viruses, as the mentioned example, can cause severe disease. More specific, the nCoV initially occurred in a group of people with pneumonia who had been accosted to the seafood and live animal urban market in Wuhan. Until now, there is no specific medication, supportive care, and even vaccines for this. Fortunately, treatment and vaccines are in development. On the other hand, it also has some different symptoms that distinguish it from a common cold. Might appear between 2 and 14 days after exposure. Fever, cough, and shortness of breath are the three common symptoms that you will get when you are affected. Besides that, it also has the other symptoms, as you can see. This is the map which it lists the places where have the patients over the world, remarkably Europe and China. There's only 204 countries in the world, but 186 have been affected. Due to the ability of infections through respiratory and virus can be available to live in the airport environment, the number of cases has dramatically raised up to approximately 300,000, and nearly 12,000 had died. Improvement of medicines and process of preventing the virus also developed in a positive way, with more than 90,000 patients have recovered. China, Italy, and Iran are three countries have the highest proportions of infections. Totally, 63.3% of victims are being infected. 4.1 are dead, but there's no adequate institutions to cure or vaccines to prevent. The rest of patients are having recovery trend. In addition, Vietnam is also a country which is contiguous to the place virus appeared, and the victims had gone up to 94 people. However, 17 over 94 had been cured and absolutely healthy. The main reasons is worker, employers, students who live in a foreign country is now return to Vietnam and bring the source of virus. The disease has been spread from those who were sick to others, include family members or even healthcare staff. Transmissions between people who are in close contact within about 6 feet, so it's very easy to spread the virus. Besides that, through respiratory droplets produced when an infected person coughs or sneezes, it also can spread the virus to the atmosphere. Prevention: covering your mouth or nose. avoiding close contact with those who are sick, far away from them, using masks or washing your hands. These are some kind of way to protect yourself and increasing your resistance. Go to hospital self-isolated if you have some symptom related to the virus. Thank you.